Good afternoon, everyone. Thank you for being here. We'll go through the data, and then we can take some questions. Dr. Gupta is here as well, and she can take questions as well. And if Dr. Gupta thinks I missed anything, she's going to jump up and let me know that I missed something and hit on that point. It's been a long December, and it's coming to an end, and hopefully so will the reality of this virus that it preys on our vulnerable. We lost 10 members of the community over the last 24 hours. We've lost 429 members of the community during the pandemic, and certainly December being the deadliest month of the pandemic. We lost a Caucasian female in her 90s, Caucasian female in her 70s, 2 Caucasian males in their 70s, and then 6 residents of nursing homes reported through the New York State Department of Health. Our positivity rate, low test numbers over the weekend, kind of something we've seen consistent caseloads. Depending on test numbers, your positive rate goes up or down a little bit. Not a lot of testing over the weekend, so we'll start to see where the true positivity rate goes, but 7-day average 6.3%, not bad. Where we were before when we were put into zones, we were in the 7% range, going to a higher trajectory. Last week we come down to a 5.5. 2 low test days push your data up a little bit, but not bad. Hospitalizations, 309 individuals are in the hospital at this time. That's down 7 from yesterday. ICU, 46 in the ICU, that's down 2. Even though we say down 7, to give everybody an idea, new hospitalizations, 26 people were sick enough yesterday to go to the hospital and get admitted into the hospital. We had 28 discharges, and then unfortunately we lost members of the community that were in hospitals. That's how your numbers move. So every day, it's not like you have 1 or 2 admissions and then 1 or 2 people being discharged. We have 26 people in the community that were sick enough to go into the hospital. And so I think that's important to know, all of that. We now have 20,006 positive cases since March 16th. That's certainly a number that we probably never thought we would have gotten to, but we're here. It's 336 new cases. We're hitting the part of the week where we typically see higher case numbers, and then the beginning of the week and maybe at the end of the week lower case numbers, so we'll see what happens here. It took us from March 16th to November 28th, 8 months to reach 10,000 cases. From November 29th to December 30th, 31 days, we reached another 10,000 cases. So I think there's a lot of reasons that we can all reflect on and see where we are. One being that certainly this season is much more favorable grounds for the virus to transmit as people are indoors, and certainly we've seen a lot of living room spread. And in congregate settings as well, lots of spread, and then it just flows through the building. So, that's why we keep talking about everything we can do, all the mitigation things that we can do collectively to try to make a positive impact so that we can preserve our hospital capacity, keep our economy going as we begin this next phase, which has been an exciting phase, and we'll get into that with vaccinations. When we look at the demographics, 10,676 female, 9,187 male, 3,083 cases of those 19 years and under, 4,027 cases in their 20s, 2,942 in their 30s, 2,429 in their 40s, 2,848 in their 50s, 2,170 in their 60s, 1,201 cases in their 70s, 820 in their 80s, and 486 in their 90s. Reminders, symptomatic testing Monday through Friday, FSHED. If you have any symptoms, we want you to go there for testing. ongov.net/Cayuga Medical. That's Monday through Friday, 9 a.m. to 2 p.m. Weekends, symptomatic testing at Essentia Health, 1050 West Genesee Street. That's Saturday and Sunday, 8 a.m. to noon. Again, go to ongov.net/Cayuga Medical for registration on that. Reminder, there is no testing at the FSHED on weekends. Don't go there looking for a test. You won't get one. Our asymptomatic program that we've been doing, we know that there's asymptomatic spread, there's asymptomatic carriers. We've really, part of our strategy to address the surge and to get in front of this is to really expand that asymptomatic testing, and it's been working. It gives us, it's a rapid test, and it gives us the ability to quickly identify the carriers who are not showing symptoms, and we do it every day. So again, asymptomatic test, covid19.ongov.net. There's various locations in the community. Then there's the On Center, which we've been utilizing every day. Today we are testing at the Arrowhead Lodge in Brewerton, the Village of Fayetteville, Senior Center, Salina Town Hall. Tomorrow we will be at Onondaga Town Hall, plus the On Center. So again, go to our website, register, get a test. It's a free test. If you have symptoms, though, you need to go to the FSHED or an Essentia Health over the weekend. A lot of things going on right now with the vaccine, so let's go through this a little bit and talk about this comprehensively. At the local level, we don't determine who gets the vaccine. How this works is the New York State Department of Health determines the phases, okay? And so that's the who of the process. Now there's lots of reports, national reports, saying the vaccine distribution's behind schedule. And there's different reports. And now people are reaching out to me saying it's behind schedule. Well, that's not the case here. So the when for the vaccine, we know who is first. And then the when, the state determines that. The when is when the vaccine comes, okay? So when the vaccine comes here, we have vaccine in our community. And the how is when, where we come in to play that role. And so initially, the first vaccine comes, we see the reports about hospital workers. The hospitals are vaccinating their own staff. 1A comes out last week, and we set up a pod, a point of distribution for the county, I believe one of the first in the state, and we then have our partners at the hospitals share the distribution of vaccine with us, so we can go take that work off the hospitals that are already strained and utilize our pod. And I believe 1A, hopefully 1A is over there. I can't see this, but I'll go through it. I almost have it memorized. But so 1A is where we are right now, this week. And now, going into next week, we'll continue to stagger in 1As because you don't want all of your emergency service workers all getting the vaccine at once. Why do you do that? If people have a reaction, you don't want to take out your entire emergency service workers to a reaction. So it's staggered. These classes are staggered. So next week, we go into the next part of 1A. And so the 1A, how do you know if you're going to be contacted? There will be outreach on 1A for the parts of 1A by New York State Department of Health, by County Department of Health, by our emergency management teams, and we will let the public know who's up right now and how do you register. If you are not part of 1A, you will not get a vaccine right now. So don't try to register. Don't try to just show up because you find out where it's being distributed. That's not how this is going to work. You can only get a vaccine if you're part of 1A right now. Then eventually we're going to get to 1B. And then we're going to have to then go do a second shot for 1A and a second shot for 1B. So we're going to communicate with you. We understand the anxiousness. This is exciting. We can crush this virus now with these tools that we have, and we will. But what we need, there's going to be a process. And so if you're in 1A, you've been notified to come this week. Some 1A will come next week, and then there's new categories next week, which is week 4, which will be allowed to come and register. But nobody can just show up. You can't show up, say, I work in this or not. We know who we're supposed to be vaccinating. We know who the EMS folks are. We know who the various other congregate care facility workers are. We know this, so don't try to pull a fast one. We'll get to everybody. We want to vaccinate 460,000 people in this county. So looking at that, again, next week, so again, let's just go over this. This is important. Frontline health workers, EMS workers, funeral home employees, staff and residents of congregate care living facilities, they've begun to receive the vaccine this past week. Okay? Phase 1 of 1A. Next week, inclusive of all health workers, those transporting the sick and those performing COVID-19 testing, those are going to be incorporated next week. So all these categories will be vaccinated. There will be certainly, we will be sharing registration links with these folks. We got to get these frontline workers vaccinated first. They deal with COVID every day. They're the most at risk to get this virus because they're working with this virus. So that's the first part. Again, we started vaccinating 1A on Monday. We've done over 600 vaccines. Vaccines have been administered. We'll vaccinate another 500 people tomorrow. These phases are surgical. Once the state tells us the next phases and the categories of those who can get vaccinated become broader, we will staff up appropriately, and we will have multiple pods, points of distribution in the community, and we'll communicate to the public where they're supposed to go so they can get their vaccine. So we spent some time there. Case investigations, our texting program is working. We're getting great response there from the public. Thank the public for that. This helps us as we see what will happen with cases. We've staffed up for a Christmas surge, a holiday surge. In the event there is, that we can continue to do the investigations quickly. This helps us quarantine and isolate quickly, which limits risk to the public. But our new texting tool is helping us with staffing related to that. Again, if you see the number 833-634-1564, you get a text message from that. Please respond. That's us. And then you can go and fill out the survey there. I just want to, as we go into New Year's, I do want to talk about hospitalizations. And I know people are anxious about talking about potential lockdowns. The way that we get into a lockdown is that our hospitals are overrun. And we can create all the hospital beds, but if we don't have staff to work the hospital beds, we're overrun. So we've had a couple good days where we've had less people going into the hospital. We're going to see what happens now from Christmas and Christmas Eve, probably next week. I don't know what's going to happen. We were going down. Our cases were going down for almost 2 straight weeks. We had 2 good days this week, a day today, which is higher, but we always get higher numbers. I don't know what's going to happen. We're going to find out what's going to happen. But if we have a surge in Christmas, all the progress we've made for hospitalizations is going away. And then if we have a New Year's surge on top of that, we're asking for trouble. So let me be very blunt related to New Year's. 2020, I can't wait for it to be over. I can't wait for December to be over. Do not celebrate with gatherings. Celebrate at your home. Enjoy it. 2021 is going to be a better year. But we cannot mess around right now. We've seen what's happened in Thanksgiving. We don't know what's going to happen with a surge with cases in Christmas. And now we got New Year's Eve. We can control New Year's Eve, right? We can control what we do. Go celebrate at your home. Enjoy it. Watch the ball drop. Watch a movie. Do whatever you do. But don't have gatherings. We are very close with having staffing problems with our hospitals. And if we have a Christmas surge, That's going to create more work there. I don't know what happens if we have a New Year's surge after that. And I don't want any economic restrictions in our county, but we need to be smart going into New Year's. Reminder, quarantines. New York State has now adopted the CDC guidance related to 10 days for a quarantine if you have no symptoms. This will be good. This will be very helpful for going back to school. This will be helpful for businesses as well. And another note is, again, our part of why we're able to get some of the discharges going right now with the capacity is our COVID transitional unit, in partnership with Loretto, has been able to take some of these individuals who are waiting a negative COVID test each day. And so that has been working well over the last few days, and hopefully, again, but this is, again, staffing. This is all about staffing. We can't keep putting pressure on the system with putting ourselves in positions for the virus to transmit quickly, because this all falls apart if we can't take care of our sick. But the COVID unit is taking out folks. It's serving its purpose. We want to hopefully expand that. Our hospitals are the hub. Just like the beginning of this process, we talked about how we were treating the sick for not just Central New York but Northern New York. We have 309 cases of COVID in our hospitals today, but we have 399 COVID patients from various total. So we're being utilized, for all of our neighbors in the North Country and Central New York. So we can't let this thing get more strained. So we got to do our part overall. We're doing everything we can from a government standpoint with trying to do things preemptively, including antibody treatments preemptively with at-risk folks so that they don't get into the hospital. But there is a direct correlation. The state has made this very clear between economic restrictions and hospitalizations. So saying all that, happy to take questions.
It seems that the situation that you were describing is already there for upstate. Dr. Corona, speaking to one of our reporters today, said, and I'm quoting him here, "We can't find staff. Nobody can find staff anywhere because the country is overwhelmed. Despite our best efforts to expand capacity and get more people to staff the beds, we're now at the point where we're full." So in terms of the county doing everything that it can from a governmental perspective, could it not be doing more to support the hospital system and maybe have more preemptive ways other than just asking people to try to, take that personal responsibility?
It's a very long question, and I could ask you a question, what do you want us to do? But I'll tell you what we do every day. Dr. Corona is right. His hospital is strained right now. We talk to all 3 hospitals every day. We're working with the hospitals in the COVID transitional unit, which has freed up 8, for example, with Upstate. 8 residents came out of Upstate today into Loretto. We are looking at what's happening is it's a good time to be a traveling nurse. You can make a lot of money, and they're in high demand from every hospital. So this is a challenge. But the hospitals are working together, and they have to work together now on communicating on who's best to take what patient as they come in. It's not just about COVID patients. It's about total patients and meeting the needs of the whole community. So we're having these conversations every day. We've put up the facility in partnership with Loretto and Upstate. We're trying to work with some of these folks to expand the antibody programming so we can, once they have the antibodies, we can get them to at-risk demographics of COVID positives, right? So if you're in all the doctors agree, you meet a demographic that you are more likely to have a hospital stay if you get COVID, how can we get that person immediately the antibody treatment? We're working on things like this from a preemptive hospitalization, and we'll continue to do that. One of the other things we've done for our hospitals is we got our pod up related to vaccinations. So the 1A, we've started vaccinating. Originally, Upstate and Krause were supposed to do that. They're not equipped to do that. They have to take care of our sick. That's what local health departments do. Dr. Gupta and our emergency management team get the pod up and running. We've been doing the vaccination for them, and we'll continue to carry that load moving forward. But it is a challenge. Upstate, a lot of stress. Crouse, not as stressed, but stressed. St. Joe's, a little bit more capacity than everybody else. Part of this is because we're the hub for all of northern and central New York. And that's what the reality is that, again, 309 of the COVID patients in these hospitals are our residents. There's another 90 patients from other counties that utilize our medical infrastructure. We're always looking for ways that we can better support the hospitals, and we're happy for other suggestions if there's areas that people think that we can do things.
Ron, what can we expect enforcement to look like for New Year's Eve? Will it be similar to what we did for the Christmas week and Thanksgiving as well?
Yeah, so the challenge, Josh, with New Year's Eve now is the way you would normally enforce this would be, let's go do our Armory Square detail, let's go look up at Marshall Street, let's go to our spots we are familiar with in the towns. These businesses are not open, so certainly there's some of those establishments outside of the zones that we can go look at, and we will, but this really comes down to choices related to living room spread. These are choices that people are going to make. If you have not heard of a case about COVID spreading at living room spread, you're intentionally not trying to hear about it because it is happening everywhere in every social circle. And if you don't know about somebody that has now died from COVID, again, these things, you just got your head in the sand. And then if you look at this is not the flu. The flu, I don't know the stats, maybe Dr. Gupta knows, but I'm pretty sure it's we lost a handful of community members to the flu in 2019. We now have lost 429 community members. You had a 41-year-old congressman-elect from Louisiana who had no pre-existing conditions drop dead yesterday from this. What does a 41-year-old look like? That's what I look like. Somebody who was in a position like me dropped out of this yesterday. Happened very quickly. So we need to be smart. Let's learn from the lessons. And the hospitals are under stress. We now have the vaccine where we're vaccinating people, and our most vulnerable are getting vaccinated. So this is about getting through the next week here while we continue to vaccinate. And we continue to do the things that work, we'll get our caseloads down, and as our caseloads get down, the hospital numbers are going to go down as well.
The governor just announced 6,700 fans will be able to attend the Bills playoff game this weekend. Have you had any advanced conversations with the state about getting fans back in the Carrier Dome or getting fans here for Crunch games, which will now start in February? Is the difference really just those being indoor facilities, the Bills being outdoor? What are the conversations?
So we had some conversations related to Syracuse football when we were in a position of strength with the pandemic. Again, when you look back, you say, geez, we probably should have, if you could have did this differently then or there, it probably wouldn't have impacted. When positivity rate's 0.5% for the community, having some fans in any venue probably represents risk, but not a lot of it. Right now, we're not there right now. I would love to be able to advocate for Syracuse basketball versus Duke or Florida State or Louisville. Won't be Florida State, they're around the corner, but a big Syracuse basketball game if our positive rate is going in the right direction, and we've proven we can do the rapid testing. We do it every day, so those are the things that we could do. But we gotta be in a position of strength to have that conversation, and to do that, we need to really start to crush this virus. Some positives from today's numbers. I think we had 8 senior cases today out of the 330. That's a good thing. We haven't been seeing those types of numbers, and 25% of our hospitalizations are from senior facilities. So these are things, you know, they're getting vaccinated. So we're making slow progress in this. But to get to there, Josh, I'd love to be able to say to the governor, you need to let us have fans at the Dome for basketball games, but I need to be able to make that case, and I can't make that case right now.
Just circling back to hospitalizations a little bit, with you saying that, essentially we're looking at stricter lockdown type measures if, our hospital system across the board is under the same kind of strain that Upstate was talking about today.
Yeah.
At any point, did the county consider taking any additional measures outside of the state's mandates? Because, we've been in these various zones, at least in the center of the county in Syracuse throughout December, and it didn't seem to make much of a dent. So is the county looking at any independent ways to try to limit the spread?
Yeah, so the way this works is we can propose, but the state has to agree for restrictions. This is the other thing, too, which is difficult with the... So I get the anti-lockdown crowd and the lockdown crowd. They're very vocal. The locking down the economy when, say, 15% of your cases, maybe even less, are related to economic activity, that's not going to solve the problem, okay? Now, if it's your only tool you have available because you can't treat your sick people because there's too many sick people for staff, it's your only tool available, right? But from the standpoint, if you can, the hospitals are struggling, if they can tough it out as we're vaccinating the vulnerable, most prone to find themselves in the hospital, and we can get through this moment in time without further economic restrictions, everybody's going to benefit from that. But I think there's a recognition from the state that that tool is not going to change things. If you 15% of your cases come from economic activity right now, the rest of it's just being spread via gatherings in homes. So if limiting 15% drop-offs in new cases isn't going to change your hospital picture overnight. So really, that if it gets to the point that that's your only tool, we're in a bad spot. And so that's kind of the recognition, I think, from the state. So what else can we do? We can do collectively what we have to do. We're communicating right now that we don't know if Christmas is going to have an impact on our numbers that have gotten better. If it does, our numbers will go up a little bit, and that will probably take up our remaining hospital capacity. So if we want to mess around on New Year's, and you want to just have a great time, and you want to have large gatherings, we're putting the hospital capacity at risk. And that's just the facts, right? Because we don't know what Christmas has done yet.
So are you able to, just to make sure, with the numbers, so 85% of, is it current positive cases, or just in general 85%?
Yeah, if you look at, the governor came out with very specific data a couple weeks ago. There's nothing to suggest that's changed. Restaurants aren't open. You're not going to have more cases coming from restaurants. It's the same thing. So I think when you look at the data, it's very clear where it's being spread. It's being spread indoors where people are having gatherings where they feel more comfortable and they're not necessarily wearing a mask or distancing. That's in people's homes. So and then those people go to work, right? And so if you're going to work and you're not staying home when you're sick or you're asymptomatic, then you see further spread. So the reality is that the lockdowns aren't going to change that. And they creates other problems. But if it's your only tool to try to slow it down, if that's your last tool that you have, I think then the state will do that. But if the state thought this could crush the virus by locking everything down right now, they would have already done it. They would have done it. They did it already in the beginning of this process. So there's a recognition that that's not the best tool here. The best tool is all of us doing what we need to do.
Did you say that there have been a total of 600 vaccinations given out so far, or is that just yesterday?
That we've done.
Yeah.
That we've done, yeah.
Okay. And then 500 tomorrow?
We'll do 500 tomorrow, yeah.
And then is that going to be kind of the going rate for a while, or how that's going to work?
Yeah, so what we said to the state, again, right now you're seeing surgical categories of who can get the vaccine. So you're going to have a first vaccine and at some point the second vaccine. But we can staff up to meet the when of this. So as the capacity for the vaccine comes available, we can staff up, and then we can increase 700. I think 700 a day is right now what we're probably staffed up for, around that. If we have to do more, because if we have it available, we want to do more. But right now, it's not. There's not people You can't just do everybody in one class. You can't have all your urgent care workers getting the vaccine the same day. You got to spread it out. So right now we're meeting the needs of the phases right now.
Is there a number that you want to build capacity to be able to do in a day? Is there a goal?
Yeah, eventually. So it really depends. What we want to do is be able to implement it as quickly as possible. And so once you get to what a 1B or a 1C or D, whatever those look like, it's going to be more it's going to just be a larger swath of individuals. So we want to be able to quickly meet that. So we know that you're going to need multiple points of distribution, and we're preparing and planning for that. So you'll be talking about thousands of vaccinations a day, not hundreds. Dr. Gupta and Dan are starting to break out in a rash right now as I talk about this.
And all of the phases 1A, 1B, and on are divided by occupation for the most part?
Yeah, the state gives out the metrics for that. So we don't, again, we're not concerned about the who's. The state's going to determine the who. Yeah. Everybody can have their own opinions. The only one that matters is the state. So we keep our opinions. We trust what they're doing based off of the science and the CDC recommendations. So they're telling us who. Give us the vaccine, and we'll get to work.
And there's probably a point at which it's just everybody can get it after you've kind of gotten all of these people you want to get first.
You probably won't have everybody, because remember, you have to be able to track. You have to track the individuals and take all the data. So your registration is going to be critical, because we're going to have people back to get a second shot within 3 weeks or 4 weeks, depending on the type of vaccine you got. At some point later on in this process, we don't know, right? Some of the different vaccines that may become available, maybe like getting a flu shot, but there's a tracking system, and so in the beginning, it's important that we get this right. Nobody's had to do this at this scale before, so that's why I think you probably see there's two things why 1A is targeted the way it is. So you get your first responders and the people who deal with the virus every day vaccinated so that they can't get it, so they continue to treat the sick. But in the other piece is just the quantities of vaccine available right now. But I think you'll see more expanded phases at the end of January. And then certainly you're going to see larger vaccination operations throughout the community.
Just last one. Do you know how many vaccine doses there are in the county right now?
I don't, because I don't know. So I know what I know what we've been, and I'm not going to talk about that specifically too much. There's a security issue with all this. I know we have vaccine to do 1A, and I think other providers may have gotten other vaccines to do different specific things as well. But again, right now, this is an emotional process. People getting this vaccine, we have reports where people are very emotional. The people are very scared. They want to get this. When you have these types of emotions, people sometimes make mistakes wanting to go try to get the vaccine when they're not supposed to. We can't have that. That's against the rules. We can be fined a lot of money. People can get arrested for these types of things. So we're not going to put out too much information where it could create security issues or people making poor decisions.
Like where the POD is? You wouldn't say that probably?
Well, I think everybody knows where that is. I'm not going to talk about it, but I think everybody, you figure that out, right? Yeah. All right. So but eventually we're going to have two. So everybody's going to know where that is, right? And so we're going to be directing potentially other people to this one, other people to that one, depending on it.
Heading into New Year's Eve, is the messaging more to make sure that we're only celebrating with those that we live with, as opposed to any other sort of pod system or anything like that?
Yeah, people need to use their best judgments, and the best judgments is to minimize this celebration period, right? So certainly it's again, we went through this with your network the other day. You guys beat me up when I used the word practical. So I'm not going to get too much into this because of that. But the reality is we know the best way to celebrate New Year's is to limit the number of people you're with. And we don't know what has happened with Christmas, right? And so because we don't know what happened, we had cases where we had 2-week drops, and this week looks like a decent week so far. We don't know what is going to happen the rest of this week with cases, and next week will be probably a direct reflection of that. So active cases directly correlate with hospitalizations. 5 to 8% of our active cases are your hospitalization numbers. If we have a peak in cases, that means our hospitalizations are going to get busier, which is not good. And then if there's another peak from New Year's, we're asking for problems. So I think people should just be cautious. It's not worth it.
When will we hear from you again? And for those who don't know, what happened with Shopping Town today?
Oh, so Shopping Town, good news. We have closed on Shopping Town Mall, so the county now has title to it. And what we're going to do moving forward is we're going to prepare a request for proposals to go out to the marketplace. And then there will be a review of these proposals, probably a 90-day process, so that people can really do their diligence and come forward with good plans. But 2021 will be a good year for Shopping Town. We'll have a new future, we'll have a new owner eventually, and new investment being made. So in a normal year, not the 100-year pandemic, that might have been one of the stories of the year, right? We've been very publicly dealing with these absentee landlords out of town who've owned this mall and let it deteriorate intentionally. And now we held in there, we hung strong, and we got the keys. So there'll be a bright future there, and that will help everything.
And when will we hear from you again?
So I'll probably, let's say Wednesday, so maybe tomorrow on something, but certainly on Monday we'll be back. Yep. Any other questions? Well, everybody have a safe and happy New Year. Please, it's been a bad year. Really, December's been a horrible month. But we've all proved to ourselves in different ways we can do things we probably didn't think we could. So I think let's be happy 2020's over. Let's do it safely and celebrate safely it's over, because 2021 is going to be a better year for all of us. But let's take the lessons we learned as a community and internally, the lessons that we've learned about what we can accomplish by ourselves through this pandemic. We've all been confronted with really unforeseen circumstances and accomplished so much. Let's take those lessons and all grow from it in 2021. Thank you.